time for your favorite show in town with your favorite host Priya, who gives you a lowdown on all the latest events and best stories in the UAE. Check out our stories for this week's episode. So let's begin with our Wellness with Zulekha segment, जहां हम आपको मिलवाते हैं with well-known doctors from Zulekha Hospital who tell us about different diseases and health problems. So today we are meeting Dr. Murtuza Pithawala, Specialist General Surgeon, Advanced Laparoscopic and Bariatric Surgeon, who's going to be telling us about hemorrhoids. Welcome to Zee Connect, Dr. Murtuza. Thank you so much for being with us.
Thank you for having me here. Thank you, Priya.
So, Doctor, we'll be talking about hemorrhoids, which is commonly known as piles. So, let's begin by understanding what really are piles.
Okay, piles is the layman term that the patients come to me when they come in the clinic, and that's what is actually known as hemorrhoids in the medical language. The anal cushions, which have increased in size because of various factors that might have played a role. These anal cushions are present for all patients. Everybody has them as normal when they are normal. Anal cushions are there, but when they become bigger in size, then they cause symptoms of piles. So this is what exactly piles are. Now there are again two types of piles. They can be internal or external piles, and when depending on which type it is, the symptoms will differ.
So, Doctor, how does one know that he or she is suffering from piles? What are the symptoms?
All right, the symptoms of piles depends on two things. So one is the type of pile, which may be internal, external, which I just mentioned, and the grade of piles. Now, grade means basically the size. It grades from 1 to 4, 1 being the smallest and 4 being the biggest. And now, the initial grades are usually present with very minor symptoms. They just might have some discomfort, some itching, some very rarely pain in the initial stages, some of them present only with bleeding. Now the patients who have the minor symptoms of discomfort and itching usually neglect this, thinking that they've been sitting for too long on something, and they've not passed the motions well, and probably that's the reason for the discomfort. But these initial symptoms, if the patient is able to catch them and come to and visit the doctor, that's the best time we can treat these piles without probably a surgery. And they do respond in initial stages to just medical management. So these early symptoms are very important to catch, which is pain, itching, discomfort, mild pain I would say, mainly discomfort and itching, and bleeding of course is something some patients when they see it for the first time usually brings them to the clinic, but some patients might be passing a small amount of blood, they get used to it and then they just sort of neglect it because it's not that frequent. As the piles progress, the symptoms of pain increase. They sometimes have some mass coming out when they pass motions, and the patients who have sometimes a really big mass coming out, sometimes they come with severe pain one fine day. This is because of bleeding that happens inside the piles. That doesn't come out, it happens inside the piles, and this causes a big lump to form, and this can be very painful, and this may even require an emergency surgery.
What are the different treatment options available for piles?
Well, the treatment options if they come in the initial stages, we offer them lifestyle changes, as in they change the diet. They try and go on to a high fiber diet, sufficient fruits and vegetables in the diet, lots of water, refined foods. People are used to grabbing a bite on the go, and it usually ends up being some sort of processed food which is very low on fiber. And these kind of foodstuffs do not help your bowels in pushing out the motions well, so then they get constipated, and then over a period of time they progress to having piles. Along with that, some exercise always helps, there's no doubt about that. It helps in you moving your bowels regularly. But the treatments that we offer now for piles are much advanced, as in the techniques that we have for various surgeries that we offer. Also we have tried, and because of the the problems that the patients had with the open surgeries, we have now gone on to the more advanced surgeries, which includes laser, which includes stapler, which includes transanal surgeries. These surgeries, they reduce the pain component drastically for most of the patients. The patients usually have pain maximum for a couple of days, 3 days after surgery, and after that they are almost very comfortable with the pain, very comfortable moving around. There's hardly any wounds out there which need dressing or follow up with the Dr. X. So the newer surgical treatments that we offer are much more advanced. For example, if the patient comes with say grade 2 or early grade 3 piles, we can offer them laser, we can give them laser treatment which is almost pain free. The patient walks home the same day from the hospital and is back to work the next day. The other surgical treatments that we offer, one of them being the THT. This is a technique which has been which has been very popular over the last 10 years, and which involves putting the stitches inside. There are no stitches outside, there are no cuts outside, and we can even take care of grade 3, sometimes even grade 4 piles with this kind of a technique. So patients are now more receptive to treatment when we show them that these are the treatments which we have to offer. Yeah. But patients coming with very late grade 4 piles, unfortunately then they end up with the open surgeries, which even we do not like to offer to patients, but when we have forced to give them because they have come so late to the hospital.
Yeah. And as you mentioned that people should come in early if they're having any symptoms so that there can be an early diagnosis. Is there anything that Zuleika Hospital is offering with their expertise?
We have a campaign running right now as far as Zuleika Hospital is concerned, where we have a second opinion campaign. This involves patients who have had been to a doctor outside and have been told that they have this particular problem, and if they want a second opinion, they can come down. If they have any reports, they can bring along, and they can come down and get an opinion as to whether they have piles, and if they have them, what stage, what grade they are. This second opinion campaign has been running for quite some time, and we'll be happy to offer them another perspective on their problems.
Okay, great. Thank you so much for sharing so much information with us, Doctor.
Thank you.
This is indeed very helpful. Thank you so much.
Thank you, Olive.
आगे बढ़ने से पहले हो चला है एक छोटी सी ब्रेक का टाइम, लेकिन I'm going to be back with many more interesting stories just for you guys, so do not forget to join me. Thank you so much for staying with us on Zee Connect. Recently, Abu Dhabi में organize किया गया Yas Movies in the Park, और इसका हिस्सा बने the very popular Arbaaz Khan, and we got a chance to catch up with him. Let's take you there. Great to have you, Arbaaz, in Abu Dhabi. How is Abu Dhabi treating you?
Well, it's wonderful to be here. I just love the UAE and particularly Abu Dhabi, Dubai. It's like places I frequent pretty often, and it's just lovely to be here. Just love it. And any given opportunity, I run to come here and just have a good time.
That's nice. And you're here for Yas Movies in the Park event where we're screening DDLJ. Do you love the movie as much as we love it?
Yeah, it's my all-time favorite, amongst my top 10 films of all time, Bollywood films. Dilwale Dulhaniya Le Jayenge will definitely be part of it. Yeah.
And Makki's character was very, very different, and we loved watching you in that character. How was it acting in that movie, playing Salman Khan's brother in the movie? How was that?
Actually, it so happened that when Jaane Tu Ya Jaane Na had released and Sohail and me had played a cameo in the film, that cameo that I played was Abhinav Kashyap, who directed the first Dabang. He had seen me in that and he had liked me, and when he was actually casting for Dabang, he had already seen me as Makki in that. So when he came to narrate the film to me, he wanted me to play Makki, and I asked him, why me? So he was like, because I saw that comedy flair that you had in Jaane Tu Ya Jaane Na, which has not been exploited, and I want Makki's character to be comic, but not in a way he's attempting, but he's really funny just by being himself.
Yeah, nice. And then you went on to directing Dabang 2. Now tell us your biggest challenge in terms of direction.
Well, firstly, since I was taking on a very hit franchise, so there was already pressure that, will I be able to live up to, and it was my first film as a director. So obviously there were going to be a lot of, eyes in my direction, like, oh, is it because, he wants to just show that, he's like, or because he's Salman's brother. But that was not the case. I thought about it long and hard. I knew what I was putting myself into. And I knew that if I was going to do that, I had to come up with a lot of preparation and a lot of focus. And I was willing to do that. And that's what I did. And so right from this, getting a new script for Dabang, the music, the casting, the locations, everything, I had to really work at it, get a good technical team. And I had obviously a know-how of, filmmaking, in the sense, because I've been a part of a film family. I've been working on films for over 20 years. I started my career as an assistant director. So it was not something that was alien to me. It was just a matter of building confidence. It's like, okay, you'll be able to do it.
Superb. And now we are all looking forward to Dabang 3, which is being directed by Prabhu sir. Yeah. Which is amazing news. And Dabang 1 and 2 have had great music. What can we expect from Dabang 3? Well,
you can definitely expect good music again because Sajid Wajid, understand the movie, they understand the demand of the character, and they've always done a great job, and, they are very talented. So I'm not too worried about getting good music. I think music will be fine, the action will be fine, the choreography will be fine. We've got somebody like Prabhu to look after it. We've worked on the script, we are happy with the script, and everything else will just fall into place. I'm not thinking too much. I just know that all the entire team has to do is to do a sincere job, and that's it's such a loved franchise. People have got such a loyalty towards the character Chulbul Pandey that, we will hopefully, not let them down. We'll probably give them something exciting.
Absolutely. There was just one question more on my mind about Dabang. Jab aapne Dabang 2 directed, so the part where Dabang 1 ended was like we expected Chedi Singh's brother to come back and take revenge, which didn't happen. So why was there a change?
It's a long story. Maybe this interview will be able to handle it. My initial script, which I worked on, I had Chedi Singh's brother come. When the film starts with that, actually, it's interesting. But unfortunately, Sonu could not do that film, so I had to rewrite that portion all over again, and that's how the little change happened. But there was that we had touched that area like you had spoken about.
Okay. So we'll talk about that long story some other time. But thank you so much, Arbaaz, for joining us here. It was lovely talking to you and knowing so much about you.
Thank you.
We hope you enjoy your stay here. Thank you so much.
Thank you so much. It was wonderful. Thank you.
Women's Empowerment Day is being celebrated across the globe, and at the Indian Consulate Auditorium, Dubai, there was a press briefing on the International Women's Empowerment Program. Let's take you there.
So this is an initiative by Ms. Arushi Nishank. She has earlier also done a program here about 2 years back related to Namami Gange. And this time she has taken an initiative to work on women empowerment. And we are doing about 70 programs during this year in India at 70. And we have included this program under India at 70. So that we can talk on diverse fields, and this field being an important one on women empowerment. So therefore we decided to support her, Ms. Arushi Nishank, in this program. There are lots of challenges that women face in the modern world, but there are challenges which are specific to India, and they come from various dimensions. There are challenges with respect to education, there are challenges with respect to profession, there are challenges with respect to, the girl child. There are several, and the Government of India has done quite a lot. And one of the flagship programs I would definitely like to mention is the Beti Bachao, Beti Padhao from Government of India. And a lot of progress has been made.
IWEP is an International Women Empowerment Program, and we believe that we need something very concrete to motivate women forward. And I always listen about the story that behind every successful man there is a woman. So we believe that this is the moment we are creating a stage so all women can come forward and show their power, empower the other women also.
We have a politician from Canada, she is coming. We have an author from Britain, she is coming. Few locals are there, then somebody from Philippines is also coming. So we are about to giving a cosmopolitan look, and we have worked hard on it, and I believe you can see the view at that day. It will look like that, and few locals are also coming. So 5-6 countries anyway you can see right now, I'm telling you, and few more will introduce.
Well, time now for a छोटा सा ब्रेक, लेकिन कहीं जाइएगा नहीं, ना ही चैनल चेंज कीजिएगा, because Zee Connect अभी बाकी है मेरे दोस्त. See you on the other side. Thank you so much for staying with us on Zee Connect. Zuleika Hospital recently organized a campaign to create awareness about colorectal cancer. Are you also thinking what it is? Well, let's find out. Welcome to Zee Connect, Dr. Adil. It's a pleasure to have you on our show.
Thank you.
So we are here to talk about colorectal cancer, which apparently is the second most common causes of cancer deaths in the UAE. And a big awareness campaign is being run by Zuleika Hospital, which is a great thing. So let's begin by understanding what really is colorectal cancer or colon cancer.
Basically, the colon is part of our digestive system, and it's the lowest part or the most distal part of our digestive system. And for reasons that are not totally clear, the lining of the colon is susceptible to develop cancer. And it tends to be a very slow process. And people have done studies showing that it can take 10 to 15 years to go from the point of having a polyp or a precancerous lesion or benign polyp to the point that you have an invasive cancer. And so in oncology or in cancer medicine, those types of cancers that are really fast growing, those are hard to catch by screening, because let's say you did a screening test, let's say you went in and got your whatever test done on January 1st, 2018. Let's say if the cancer was fast growing, then by the time you repeat it the next time, which could be 5 years or 10 years away, all kinds of things could have happened. But with colon cancer, because it's so predictable and slow growing in many cases, we think that if you even do screening at a certain regular interval, whether it's 10 years or 5 years or more often if you have a family history, or if you have symptoms, or if you have what is known as ulcerative colitis, it's a kind of disease that people have manifested by like a lot of cramping and diarrhea. So if you and that is known to be a risk factor for colon cancer. So if you have one of those type of things, and if you go in and get a colonoscopy done, you could actually catch it at a very early stage, maybe when it could be totally cured surgically, or maybe before it has even spread to the wall of the colon.
Right.
Like it's what we call stage 0 cancers,
Right.
which essentially are hard to catch if you wait for symptoms to happen.
Yeah, absolutely. Great. Thank you so much, Dr. Adil, for
Thank you very
talking to
much.
us. It was very, very informative. Thank you.
Thank you very much.
Dr. Robert, thank you so much for joining us on Zee Connect.
Thank you so much for having me here.
So we're going to just take the discussion further that we were having with Dr. Adil about colorectal cancer, and he also mentioned that there's a formation of a polyp usually, that's one of the earliest symptoms of it. So can you tell us what really causes a polyp to form?
Well, very good question. Colon cancer, and in fact polyps, which are precursors to the development of a cancer but are benign for a long period of time, represent genetic changes, not in all your cells, but in the cells, some of the cells that line the bowel, which Dr. Dowd described. When those cells acquire mutations, perhaps from toxins in your food, perhaps because of bad luck, we really don't know in all patients why you develop these mutations. When a few mutations develop it transforms those cells that line the colon into growing, replicating, aggressive cells. And as those cells multiply, they form a mass. It can be small, it can be the size of the tip of one's finger, or it can be larger. But they start out as growths, but that are benign, meaning they're not malignant, they don't spread elsewhere. They can be removed completely, and the polyp is gone. However, over time, most of those polyps, those growths that are benign, further acquire more mutations, more genetic changes, and that leads to a change in their behavior. And the change is now an aggressive, invasive cancer.
Well, doctor, that was really very informative. Thank you so much for sharing so much information. I think after breast cancer and cervical cancer, this is one cancer which everybody should really be aware about and get themselves screened and tested so they can prevent it if possible.
Exactly right.
Yeah.
Thank you for having me.
Thank you so much, Dr. Robert.
My pleasure.
The Zee Jaipur Literature Festival is India's most popular and sought-after literature festival. Now we're going to be able to witness this festival across the globe as well. और फिलहाल Abu Dhabi में आए इस festival के creator Mr. Sanjoy Roy, and we thought we should catch up with him for a little gupshup. Thank you so much, Mr. Sanjoy. It's great to have you here with us. So I was hearing you talk, and you are like the man behind the biggest literature festival on earth. So tell us, what brings you to Abu Dhabi?
Thank you, Priya, and thank you for doing this. You know, the Zee Jaipur Literature Festival has now grown into one of the biggest literature brands in the world. Abu Dhabi, I'd come last year. Sheikh Nayan had wanted to set up had inaugurated a year of culture, and the idea was really to look at the opportunity of bringing some stuff from India which was more eclectic in a sense. Of course, there's so much that comes to Abu Dhabi and Dubai, there's so much of Bollywood, etc. But perhaps there's still a space for work of excellence that doesn't find its way here. So one is, of course, at the Abu Dhabi Dance and Music Foundation Festival, which is happening right now. We've collaborated. India is the country of focus. So we have a whole slew of work that's going to be showing here. They've already done the Bollywood Express. Today is Tanushree Shankar's production, which will open. That will be followed by Ustad Amjad Ali Khan's performance. And we'll close with Raghu Dikshit's concert.
And you've also taken the festival international, maybe not the same, but different versions of it in various countries around the world. When did that thought strike you that you had to take it international?
So, you know, I had always been very keen to explore how we can take ZJLF across the world. So I'd been doing a lot of work in terms of what's the best place to set it up. So the first platform that we did was we worked with South Bank in London, and we created ZJLF there. And then 2 years ago, we moved to the British Library. So it's now ZJLF at the British Library. And then we started exploring America. And in America, I'd been exploring for some years. We looked at New York, we'd looked at Seattle, we'd looked at Boston, Chicago, New Orleans. And then one fine day, I get this email from these three people in Boulder who sent me this impassioned email as to why they thought that we needed to set up shop in Boulder. And I was like, where is Boulder? You know, I had no idea where Boulder was on the map. And so as it happened, I was going to be in America in 10 days. So I flew into Denver, we drove down to Boulder. And it was such an incredible city. Setting against the Rockies, the foothills of the Rockies, the jumping off point in so many different ways. And I thought this is a perfect place, but not necessarily because of its pristine natural beauty, but primarily every time I went there and every concentric set of people who I spoke to were engaged, had read, had traveled, and nobody asked me how I'd come up with the name Jaipur and whether it be named after the perfume. And I said, this is it, let's do JLF at Boulder. And in America now, we have a relationship with MoMA. So we have a version there, a pop-up in New York. We're looking at Houston, and then we're looking at perhaps extending it to Toronto as well.
So thank you so much for talking to us. It was great. It was great listening to you. It was great listening to you even now. Thank you so much.
Thank you so much, Priya. Thank you for doing this.
Just like all good things come to an end, it's time कि मैं भी आपको बाय बाय कह दूं क्योंकि Zee Connect का ये एपिसोड होता है यहीं पर खत्म. लेकिन I promise to be back next week with many more interesting stories for you guys. So do not forget to tune in with us. फिलहाल के लिए from the entire crew of Zee Connect here at Ibis Styles, Jumeirah, Dubai, you guys have a great week ahead. See you soon. Most popular and sought. Thank you so much for staying with us. Thank you so much for staying with us on Zee Connect. ये चलेगा. Then I forgot by the time we were setting